This week's Ask Dr. Durie comes from a newly diagnosed patient who has just learned about the International Myeloma Foundation, the IMF, and asks, in what ways does the IMF contribute to the myeloma community? And I certainly appreciate the opportunity to try to answer this lady, and I would like to emphasize 3 ways which I think are particularly important contributions that the IMF makes. The first one is knowledge is power, and this is the philosophy which the IMF conveys to patients about how we would recommend that they approach their treatment. They should be as well informed as possible. We want them to be educated, to learn about their disease, so that they can get the best treatment and have the best support to go through the side effects and different problems that will undoubtedly emerge as they move through the different phases of their disease. And so the IMF is committed to get that knowledge to the patient through seminars, through booklets, through teleconferences, any way that will work through the website, so that they can have that knowledge and can have the maximum power and ability to get that best therapy that they need. A second way in which we contribute is through the collaborative research, which is a key part of the International Myeloma Working Group, a group established by the research division of the International Myeloma Foundation. And this is the bringing together of approximately 170 myeloma investigators from around the world. These are the top myeloma investigators who come together on a regular basis to discuss the key questions that we face as clinicians and as researchers. We talk about what are the guidelines that we need to provide to the myeloma community to try to ensure the best therapy for patients. And what is the research that is needed to understand the disease better and come up with new approaches for therapy and for diagnosis and monitoring. And so the International Myeloma Working Group is a key collaborative research group that makes a major contribution to the myeloma community. And then thirdly, a very specific research project, the Black Swan Research Initiative, is one that the IMF is especially proud of. This is the project which focuses on the use of minimal residual disease testing. The IMF, collaborating with a team in Spain, has come up with a method to study the bone marrow very carefully and assess if there is any myeloma remaining in the bone marrow. Based on this information, it's possible to recommend, is there further therapy that needs to be given? And if so, what type of therapy might be the best to try to eliminate that minimal residual disease that has been detected in the bone marrow? And so this project, the Black Swan Research Initiative, provides a framework which allows clinicians and researchers to move towards achieving cure for myeloma. And so the IMF is proud and very pleased that we can offer this program to the myeloma community and hopefully contribute to much longer survival and to the curing of patients with myeloma.